Welcome to the Daily Dose of Derm podcast, your go-to podcast for all things dermatology. I'm Dr. Mohiba Tareen, a board-certified dermatologist and the founder of Tareen Dermatology. Join us as we dive into the fascinating world of skincare, beauty, dermatologic treatment, and how to enter the world of derm. Whether you're a skincare enthusiast or an aspiring medical professional, this podcast is your daily dose of knowledge and inspiration. Get ready to uncover the secrets to healthy skin and discover how to make a meaningful impact in the field.
Welcome back, everyone, to another episode of the Daily Dose of Derm. I'm your host, Shiab Adam, and today I'm with one of our amazing dermatopathologists here at Tareen Dermatology, Dr. Andrew Virata. Dr. Virata, thank you so much for being here.
Thanks for having me.
Thank you so much. Yeah, right off the bat, just go ahead and tell me about your background, your upbringing, where you grew up. Take me to the beginning.
All right. Well, I grew up in La Crosse, Wisconsin, so not too far away from here.
All right.
I'm the youngest of four children.
Okay.
And kind of an interesting little fact is actually my father is actually a pathologist, so a retired pathologist now, but he was the chair of pathology at Gunderson Medical Center in La Crosse.
Yeah.
So, and then as if we didn't need more pathologists, my brother-in-law is actually a pathologist in Madison,
Really?
Wisconsin too. So
Nice.
between all of us, we have enough pathologists to keep the information going around.
Yeah,
so,
for sure.
Yeah.
Was that kind of your first essence of being a doctor, was that kind of the spark that wanted you to
because
get into the field?
I got to go along and see a lot of my father's activities when he would work at the clinic, or sometimes he picked up locum tenens jobs in Eau Claire, actually, for a group that I was with for some time. So I was able to kind of see a little bit of the process at that point. No, I knew I wanted to go into medicine, but I wasn't, sold on pathology that early on in my life. So,
Were there any specialties that you were considering despite dermatopathology?
I thought about general surgery, type of surgery. I also had thought about oral surgery after having some wisdom teeth removed. I thought that was kind of a
You got a kick
interesting process too. So, so I had considered some of the surgical fields as well too.
So being a dermatopathologist, for those that don't know what that is, what is that role you play for us here at Tareen Dermatology?
Okay, so at Tareen, I'm the director of dermatopathology, and dermatopathology really is the study of diseases of the skin, both on a microscopic and molecular level. So often we use a microscope to determine whether or not there's a disease state present in the skin, and that if there is, we are the ones who would issue a report on that and provide that to your dermatologist or practitioner.
Gotcha. So there is a distinct difference between being a dermatologist and a pathologist.
Yeah, there are some dermatopathologists who are also dermatologists, and there are dermatopathologists who come from the pathology side.
Gotcha.
Some of the dermatopathologists will also see patients and process tissue and read slides. But if you're from the pathology side, typically you don't see patients.
Amazing. Did you know early on in your career that, you maybe did not want to be more focused on, patient care, direct patient care, where you really wanted to be more on the pathology side? And were there any factors that led into that?
I think in my med school rotations is when I first realized that. I found that I actually liked talking to patients. In fact, I liked talking to them so much that at the end of the day, we'd have such great conversations, but I'd find myself pretty exhausted, actually. So I found that when I was able to rotate through pathology and I was able to spend time under the microscope, that I was able to kind of get through my daily workload. I enjoyed it, and I could come home still with some energy left, not having had all of those conversations.
Having it depleted. And
more just conversations with coworkers and colleagues, and of course with our clinicians to kind of have that clinical pathologic correlation. So
yeah. Where'd you go to medical school?
I went to medical school at Meharry Medical College in Nashville, Tennessee.
Amazing. What was that like?
That was a change for me. I mean, I had been in Madison for 4 years, and I had actually applied to several different med schools, and it was on a waiting list at Meharry, and had moved to North Carolina for 1 month while I was on that waiting list, and I was going to take some classes at UNC Chapel Hill and kind of just build up my resume.
Yeah.
And at that time I got called to go to Nashville. So
There you go.
off I went.
What was it like living in Nashville?
Nashville was fun. Initially, I wasn't a fan of country music, but it did
It won you
grow
over?
on me.
Yeah.
To this date, I will listen to country music. I enjoy it, all sorts of different music genres. I just almost wish at that time when I lived down there, I had appreciated it more, and then I would have been able to catch a little bit more of it.
For sure. Yeah, it left an imprint on you.
Yeah. Instead of having my head always just in the books.
Right, absolutely. So take me through your overall experience during your medical school, your residency. What was your work-life balance? Were there any struggles you kind of went through finding that balance or any?
Yeah, there's definitely struggles because it seems like each step along the way as you progress towards becoming a physician, in this case a dermatopathologist, you're going to be tested at every point before you can proceed to the next step. So it's kind of like when you're a pre-med, at some point you're going to take the MCAT test. You're going to see how you did and you're going to apply to medical school. And then if you get accepted, the next set of tests that you're going to undergo are the USMLE exams. And there's 3 of those. So you do have to pass each one of those to progress onward and graduate from medical school. And even beyond that, when you get to residency, you're still working towards eventual board certification in whatever residency you choose. So there's all of these kind of high stakes exams that you take along the way, and they basically never stop.
Yep. It's the gig.
Even today, we participate in maintenance of certification for a board certification, and we answer questions every quarter, which are graded. And over a 10-year period, you need to get a certain percentage in order to maintain your board certification. So
your path to becoming a dermatopathologist, it consisted of simply, doing a residency within it, or was there any other additional training you needed?
So, it starts out with 4 years of college to get into medical school, then 4 years of medical school. And then at that point, there are 2 ways to get into dermatopathology. You can either do it from the dermatology side or the pathology side. I did it from the pathology side, and so I had 4 years of residency in anatomic and clinical pathology. And then after the residency, you can choose to do a fellowship, which I did, and that was a dermatopathology fellowship at the University of Vermont, which was a 1-year fellowship.
Incredible. Can you give me any insight on any of the current or latest developments within the world of dermatopathology? Has there been any sort of, I don't know if there's any breakthrough inventions or any sort of useful method that's now being implemented within the world?
Well, there's actually a lot of new developments in all of pathology, but also dermatopathology. The use of immunohistochemistry, which are very specific tests that look for very specific antigens on the tissue to identify certain tissue types or disease processes. Those we're developing new ones all the time and integrating them into our practice. And also there's more and more genetic abnormalities that we're learning about tumors every year. Even to the point where you can do an entire gene panel on a melanoma tumor, for example, and come back with just tens of abnormalities and things which can be statistically thought through to see whether or not it supports or does not support a benign or malignant diagnosis. So
Incredible.
it's getting to be more and more complicated in every area of pathology, basically. So,
in what ways do you try your best to kind of stay relevant within that field? All right, in terms of, is there any sort of outreach source for dermatopathologists nationwide that you can kind of refer to?
Yeah, we use the Mayo Clinic in Rochester as a referral laboratory, and they're pretty cutting edge on the latest in gene panel testing and antibodies, et cetera. So between that, we're really lucky to have 4 board certified dermatopathologists here, all that have had different backgrounds and trainings. So we're all keeping each other fresh and current. We all attend CME meetings, read journals, have colleagues and peers that we can reference to. So between all of these things, we tend to stay up and current with what we need to know.
For sure. So take me into your day-to-day. Are you just in a room surrounded by a mountain of skin specimens, just kind of sorting?
Sometimes.
Take me through your day-to-day.
So a typical day for a dermatopathologist is in an office setting. You might have, we have microscopes, kind of big desk workspace and everything. So typically we do have glass slides, and we have a certain workload that we want to get through every day.
Yeah.
So we might triage our specimens, ordering any special tests that we need to work them up properly, and then kind of go through the cases one by one until we're through. So we definitely are in an office-based setting, though. Yeah.
On average, what number would you say of specimens you go through?
It can vary depending on caseload that comes through from the clinic, but you could see anywhere from 50 to 150 cases. You know, it very much depends on just that workflow.
In the simplest way possible for those that don't necessarily have a significant background in medicine, dermatopathology, could you walk through the process of like how to diagnose a skin cancer?
Okay,
like,
sure.
As you like look at it under the microscope.
Yeah, sure. Okay, so let's say you have a skin biopsy taken by your dermatologist. They remove either a small shave biopsy or punch biopsy of tissue, and they put it in a small container and send it to the laboratory. So that small container is filled with formalin, which fixes the tissue. It basically keeps that tissue from breaking down. Then once it's received in the laboratory, we give the specimen a number, and the tissue is then grossed, is what we call. It's described, the measurements are taken, ink is placed on it, and if it needs to be cut down to size to fit in our containers, we'll cut it down and put them in our specimen cassettes. Then the tissue gets processed in a processor and eventually cut into little thin 4-micron wafers of tissue that go onto a glass slide. And that is the glass slide that we look at underneath the microscope to determine what are the structures that are present. Are they normal, or are they in a disease state? Sometimes it's very easy, like basal cell carcinoma or squamous cell carcinoma. You can see that very easily right off the H&E slide. Often ancillary tests are not needed. We can make our report right off that first slide. But there's other types of tumors, melanocytic lesions, atypical nevi, melanomas. They're often not so straightforward, so you might need to order additional cuts through that tissue. You might need to order special stains, antibodies like melon A is one antibody we frequently use to identify where the melanocytes are. And based on how the tissue looks under the microscope, we're able to construct a diagnosis and a report that tells the dermatologist the best course of action to treat that lesion.
Amazing.
So,
What would you say is the most common condition or diagnosis you come across?
Most common one at our clinic are pigmented lesions, atypical nevi, and very important lesions because often atypical nevi show some overlapping features with malignant melanoma, which is, of course, a potentially deadly tumor. So we probably see more pigmented lesions than we do other tissue types. Like we also see basal cell carcinomas, squamous cell carcinomas, and we see skin rashes. So probably those are probably our most common lesions that we see here.
Yeah. As you were talking, your voice reminded me incredibly of Bob Ross. So you're thinking that you're literally the Bob Ross of dermatopathology, and you may need to add that to your job title.
I should put that on there.
No, your cadence is on point. Going into some of the more challenging aspects of your field, what are some of the things that you think maybe nationwide most dermatopathologists will face, or maybe it's particularly something that you have a challenge with on your day to day? What are some of the things that really affect the field?
Sure. Well, there's probably like two ways to think about that. I'd say from a dermatopathologist perspective, the development of new immunohistochemical antibodies and discovering new genetic abnormalities and tumor types is definitely becoming more of a challenge, as we find that certain tumor might look one way underneath the microscope, but might have a different genetic abnormality that suggests it's going to behave differently. So in terms of the dermatopathologist, that's probably one of our greatest challenges, is integrating these new tests and studies into our reports.
Right.
But I would say from just a day-to-day perspective of operating a laboratory, staffing can be quite the issue. Histotechnologists are the people who are actually sitting at the bench, cutting the tissue, processing it, making our slides, and they're very much in demand these days. It seems as though they're in more demand than ever, yet there's less schools than ever producing these histotechnologists. So even things as simple as staffing can be challenging these days.
Yeah, absolutely. Getting to work at this clinic for about 2 years now, I've gotten the chance to kind of see you as well as Dr. Tareen, in the thick of it, reading samples for Mohs layers, Mohs procedures, things such as that. Is that a pretty, common type of method in order to help diagnose certain conditions, reaching out to your colleague,
Sure.
another voice on
it's some clinics that it's maybe could be frowned upon because they see it as being inefficient, but that's the complete opposite of what we do here. Anytime one of our dermatopathologists has a question about a case, we don't hesitate to show each other to get a second opinion.
Absolutely.
In fact, we even have a system set up where we can just automatically place the case into another pathologist's queue for a second review. So we definitely see that as an important process of delivering a quality report.
Absolutely. Looking into more of the future of dermatopathology, are there any upcoming, technologies that are, kind of in the talks of, being implemented within the field of dermatopathology? Anything that you're maybe looking forward to or maybe anticipating?
Well, I think digital pathology is definitely an up-and-coming field. Right now, it seems as though it's more limited to the kind of larger institutions, like academic institutions, bigger groups. But as of right now, digital pathology is kind of an extra step in the process of issuing your pathology report. It would be scanning that glass slide so that it can be viewed on a computer without having to have a slide. It's not quite accessible for the typical private practice small group, but at some point I see that coming on in the future. As technology advances, it should become more affordable. And with that technology, things like artificial intelligence may eventually kind of work its way into the process, where potentially AI could kind of pre-identify a certain tumor type or a certain pattern in that biopsy, and possibly even kind of pre-populate a report with its thoughts. And then, of course, you as the dermatopathologist may be able to come in and kind of verify at that point and see that it makes sense. So I see that as something that's coming down the pipeline. It's not there yet. Eventually, I imagine it will be there.
Yeah, crazy feats to be reached. You mentioned digital dermatopathology. Do you think there's any limitations with that overall?
There were limitations in the past, aside from cost. Some of the earliest systems that I've seen out there didn't have the kind of resolution or speed that you could have with a glass slide, which is pretty much the gold standard. But a lot of the more recent systems are really good. I've had a chance to work with some of them, and I would say the quality and speed is comparable, and sometimes can even be better depending on the situation. So it's definitely an advancement that we'll welcome when it's able to come. So
no, that's incredible. That's incredible. Say I'm a medical student, I'm in my residency, and I'm possibly considering a career in dermatopathology. Is there any pieces of advice you can give me to help prepare me for my road?
First, I would definitely do a rotation in dermatology and in pathology. If you have an interest in dermatopathology, probably during those rotations, you'll get a feel as to whether or not it's for you or not. Not everyone is cut out really to kind of be behind a microscope or computer screen for that long. Some people are going to need that direct patient contact. Others won't need it. So I would say if you can get a rotation in both of those fields, it should help you decide between them pretty easily.
Okay.
So
do you again, as you say, as a dermatopathologist, you're behind a microscope, you're usually not surrounded more towards patient direct care. Do you have any sort of like memorable cases you've been able to be a part of?
There is one case I can remember from my past. It's association of sebaceous neoplasms with certain syndromes. So I had a young patient, kind of in the low 30s, that kept having these little bumps on the face, and they would be biopsied, and our laboratory would read them as sebaceous adenomas. And we were able to put the connection together that if a patient has multiple sebaceous neoplasms, it's possible they have an associated syndrome. In this case, that syndrome is called Muir-Torre syndrome, which the patient did end up having. And so the advantage of having recognized that these skin lesions, benign skin lesions, can be associated with a particular syndrome actually allowed that patient to be worked up for the syndrome and eventually had a colonoscopy, and they actually did find a colon tumor in that patient. So potentially something as simple as finding a certain type of skin lesion and associating it with a syndrome could actually be life-saving.
Absolutely. Yeah. That's incredible. What are some of the more rewarding aspects of the work? Yeah, I feel like you maybe just stated an example of that.
Yeah,
Do you have any other aspects of the work that really bring you fulfillment in that way?
Yeah, I've thought about that many times, and I think a lot of laboratories out there don't have board-certified dermatopathologists, and so they focus on all of the areas of pathology. But I think some of the lesions and the lingo are actually quite difficult to come up with an accurate diagnosis. So one of the more satisfying aspects I've seen is when, for example, someone has a long-standing skin rash, something that's been significant and has caused the patient, a lot of problems. And the reports that maybe they'd received in the past were pretty generic, non-specific, and they weren't able to get the help with the specific treatment they needed. But in several circumstances, I know I've been able to pinpoint the diagnosis, having had that dermatopathology training, and get that patient that diagnosis that gets them better. So
Are there any, I feel like there's misconceptions with any, field career. Are there any misconceptions within DermPath that you'd like to clear up for the people? Wondering
I don't know that there's any misconceptions. Maybe some people would think that not seeing a patient directly was maybe too boring for them not lively enough. But I find that, interacting with colleagues, sharing cases, difficult or interesting cases, et cetera, is pretty rewarding. So other than that, I don't see any other real misconceptions.
Yeah, no, absolutely. As a generic audience member listening to this podcast today, are there any, resources for the general public to reach out to if they want to just learn more about the field of dermatopathology? Is there really anything that you recommend online?
That's interesting because dermatopathology, it's such a little niche area, as is almost pathology in general. So I would say certainly if one wanted to learn about like anatomy, cellular anatomy, you could buy a histology book and start looking through and seeing what normal tissue looks like underneath the microscope. If most people don't want to take it that far, certainly there are resources out there that at least talk about pathology reports, certain diagnoses, and how they would be treated. So I would say if a listener was interested in finding out more about the lesion or tumor that they had on their pathology report, certainly there's a lot of web-based resources and texts that could kind of give them more information on it, and maybe they would be more informed on how they would like that lesion treated, and the potential outcomes. So
absolutely. Amazing. Well, thank you. To close out, let me just go ahead and ask you this. When you're not doing what you do every day, what do you like to do to relax? What do you like to do in your free time?
Well, lately I've been kind of working on an old Mercedes-Benz Unimog and a small BMW Isetta, kind of restoring those.
All right.
It's been a lengthy process, but I'm getting pretty close on the Mercedes, and
there we go.
The BMW is still kind of a work in progress. So, other than that, I like being on the hobby farm with.
Thanks for flexing on us, Dr. Virata. That's kind of
these are old cars.
Incredible side gig you got going on.
Yeah,
there.
One's a 1955 and one's a 1972. So definitely some vintage cars.
That's pretty awesome.
But otherwise, I enjoy kind of ATVing and with my my kids and working on the hobby farm with my wife. So
there you go.
Yeah,
that's amazing.
That's
awesome.
where you usually find me. So
there you go. We'll find you there. Thank you so much for being here, Dr. Virata. It was an absolute pleasure.
Thanks for having me.
For the listeners out there, thanks again for tuning in to another episode of the Daily Dose of Derm. Stay curious, stay inspired. I'm your host, Shiab Adam.